Hello, I'm Mark Hillen, editor of The Ophthalmologist, and I'd like to give you a sneak peek of our February issue. Readers in Europe, it's time to celebrate our 50th issue. My editorial celebrates that fact and delves deep into what's influenced me, editorially, over this period. I may have used the phrase Wired magazine for ophthalmologists in there. Readers in North America, my colleague Ruth Steer has written her inaugural editorial, Dangerous Deja Vu, in which she expresses her shock at reading at yet more patients receiving unapproved stem cell therapies in the US and losing sight because of it, and asks for an all-hands-on-deck approach to deal with it. Upfront has some interesting stories: a new glucose-sensing soft contact lens, a new understanding of how the pupil behaves during sleep, how statins reduce the revitrectomy risk in patients with RRD, a genetic link between central corneal thickness and glaucoma, and we herald the return of the Ophthalmologist's Top 100 Power List this year. Hint, get voting. In my view, sees Marconi Santiago and Alan Saad trade blows over the claim that percent tissue altered predicts post-LASIK ectasia, and the difference between the terms risk factor and predictor. And Martin Yeager laments what's lost when physical posters are replaced with e-posters, interaction and the potential for collaboration. The cover feature sees Laurie Hurst tell his story of how he developed a gold standard treatment for pterygium, almost perfect cosmesis with virtually no recurrence, but nobody wants it because the disease is seen as trivial and his surgical procedure is difficult and time consuming. In practice, sees M. Scott Hickman review small incision cataract surgery. He explains that although it's seen as a developing country's technique, the procedure can have good outcomes and the ability to do it can be extremely useful when you're dealing with rock-hard cataract, even in the most state-of-the-art ORs. If you think about smartphones, it's incredible what tiny pieces of tech are in them. I'm not talking about the tiny pixels in Retina HD displays, I'm referring to accelerometers, gyroscopes, ambient light and proximity sensors. Next Gen sees what the combination of those components in a spectacle-mounted visual behaviour monitor can bring to the premium IOL party, as the device can determine what activities someone performs, at what distance, under what lighting conditions, and determine the optimal IOL or refractive intervention for that patient. It's somewhat more objective than chair time in a questionnaire. The profession section sees Pravan Angadi and Rob Melendez examine ophthalmologists' Twitter use, and David Almeida combines what he's learned as a CEO and a surgeon to practice decision diagnosis, advising how to make the best decisions without procrastination. Finally, we sit down with Mr. Smile, Walter Secundo, and chat about his life and works to date. It's a cracking issue, I hope you like it, and if you have any feedback, everything can be commented upon at www.theophthalmologist.com, so see you online. Goodbye.